launched the first drug to ever be approved specifically to treat postpartum depression.
Here to talk about what that means is our medical expert and new mom herself, Dr. Mandira Mehra. Good morning.
Good morning.
So I don't think people really know how common postpartum depression is in the first place.
It's true, and there is a difference between just having the baby blues and really having that postpartum depression. Baby blues is sort of those first few days, maybe feeling a little more emotional, a little sad, perhaps crying some, but really postpartum depression can happen in that last trimester as well as the beginning of after giving birth, obviously. And it's very severe, and it does affect 1 in 9 women.
Wow.
So what we're talking about is much more severe symptoms. So you can feel apathy, you can feel sadness. In extreme cases, you may want to harm yourself or the baby. There have been, of course, reported cases of suicide. So if you feel any of these symptoms, first of all, you do want to consult your physician. Let them know there's things we can do. But this headline is amazing. There has been no actual medication approved for postpartum depression to date. And so this is the first medication of its kind. It's very exciting. We do want to review, of course, risk factors and benefits of the medication. So first of all, it's an intravenous medication, and it does have to be administered over 60 hours. So 60 hours is a long time. You do have to, of course, have an adult with you if you have your children, because while getting the medication, you may not be totally with it, and you may have other symptoms like headache, dizziness, even total loss of consciousness. That's the first limitation. The second limitation is the market price is supposed to be pretty steep for this, somewhere between $20,000 and $30,000 approximately. That's the second thing. The great things about this medication, though, is unlike a lot of other antidepressants on the market that do take perhaps weeks to months to really kick in, this is a medication that could take effect within hours. So again, in phase 3 trials, it has shown that women reported feeling better, able to maybe cope with all these symptoms within hours of the medication.
Wow.
And so to be determined how widespread it really will be used, but definitely something exciting that there's even a very specific targeted drug out there now for postpartum depression.
We have about a minute left, and coming from my hoarse voice and throat right here, we wanted to talk to you a little bit about this second strain of the flu that's making its rounds right now, because it seems like, and we've heard from the CDC, that the flu may not have even peaked yet this season.
It's true, and so what we've seen so far is that first strain, the H1N1. Now we're seeing a second strain. So what this means is, I had a patient earlier ask me this week, Dr. Mehra, can I really get the flu twice in one season? I'm not feeling great. And I said, unfortunately, it's true. Well, I still encourage people, and the CDC is encouraging people to still get that flu vaccine. It's not too late. That's still the #1 thing we can do. The #2 thing we can do is try to keep our immune systems up, healthy eating habits, hand washing, covering up if you cough, things like that. But the things to really keep in mind here is that if you do have the flu, still talk to your doctor. There's 2 different, not necessarily treatments, but medications out there that could help reduce symptoms and still can reduce the spread of flu. So yes, you can get the flu again, but if you've already gotten it, you probably have the resistance to that first strain. But if you are feeling not great, if you're feeling those symptoms of just being run down and stuff, you could be having the flu, unfortunately. It may peak all the way until April, May even. So even though spring is on the way, the virus didn't get the memo.
Come on. Neither did Mother Nature for a little while there, but I think we've got that taken care of. Dr. Mehra, it's always good to see you. Thank you so much.
Great to be here.
Have a good one. All right, today is Down Syndrome Day, and we are going to introduce you to one area mom who says her toddler with Down syndrome has taught her more than she